Jazzcast Pros.
Welcome to the Healthy Illness Podcast. I am your host, Kelly Marie, and this week we are talking about Black maternal health. The Healthy Illness Podcast is a podcast all about helping you build healthier relationships while living with mental health conditions. I am a Black woman, and since we're talking about maternal health, I am a Black mama in this world, and I live with mental health conditions. Black Maternal Health Week has just wrapped up, and I thought that it would be all of our best interests, right? To make sure that we are continuing the conversation past the moment that everyone is talking about it. And so we talk about Black history outside of Black History Month. We talk about women's history outside of Women's History Month. And we're going to talk about Black maternal health outside of Black Maternal Health Week. As you know, I am a doula, a birth and postpartum doula. And in addition to my day job where I work in health equity, overarching for the members of my county, I am also a doula in my outside of 9-to-5 space. My focus as a doula are birthing people that have Medicaid and Medicaid managed care programs. I work with all parents, all mamas, all people that are birthing and their families. And my specialty group, or the reason why I became a doula, is to work more with birthing people that have Medicaid or are low income or have low resources, because we are the group that is most impacted by negative health outcomes. Black birthing people in general. And so in this case, I'm going to say Black women, because that is the data point that I have is Black women, even though the work for me is inclusive of all birthing people. Black women are 3 to 5 times more likely to die from their post-delivery health issues than their white counterparts. So let me say that again. Black women are 3 to 5 times more likely to die from complications of birth than their white counterparts. That is not just in that immediate postpartum stage. It's not just in the birthing and delivery process, but in that year following Black moms after birth. We are 3 to 5 times more likely to die than our white counterparts. And so when we have conversations like, I don't see color, or all women should be treated equally, all women should receive the same care, or personally, people will tell you, I've never experienced negative outcomes being in a Black body, or I've never seen that happen. And I want to demystify the seeing and the experiencing, because you don't actually know if you're being treated differently because of the skin that you're in. There are preconceptions, there are baked in biases that health professionals have around Black women and Black bodies and Black presenting women that don't come out of their mouths as, I am treating you differently because you're Black, or I am listening to you or not listening to you differently because I see you as a Black woman. And so while I understand that viewpoint, that is not what the data shows. And so it's important to understand, even from the position of healthcare professionals who say and believe in their hearts, right, that they don't treat their patients any differently, that they want all of their patients to succeed. They want all of their patients to be healthy. That may be personally what they feel and think and try to uphold in their practice and in their life. But again, that is not what's showing in the data. And so here we are. A lot of the conversations that we have here on the Healthy Illness Podcast are what I would consider difficult conversations because we are saying the words that people are afraid to say or don't want to say or have been told it's illegal to say. We are breaking apart data and looking at health outcomes and life and living from a place of, this is what the numbers say, not necessarily this is what you may feel. We also bring in my personal experiences and my life story and the work that I do, how I've been treated. In this case, we're talking about maternal health outcomes and So I have been through the birthing process 3 times. I have had a miscarriage. I have had abortions. I've had a hysterectomy. And so I no longer have my uterus. I had fibroids in my uterus and was experiencing very heavy bleeding and painful periods for several years. And so I personally have experienced and gone through many of the health issues that affect Black women. And I don't see myself as being any different as the next Black woman, or honestly, the next woman, the next person that has these body parts. I personally do not see the difference in how I'm treated or the treatment I receive personally. No nurse has said to me, "Oh, I'm not listening to you because you're Black." I've not heard clinicians standing outside my door, saying derogatory things about me because of my skin color. That hasn't happened in my experience, but that doesn't mean that it's not happening. You've seen the videos. I feel like if you listen to this podcast, you have also seen some of the videos that are out there showing how Black women are treated in emergency situations as it relates to their birthing status, as it relates to their bodies and body autonomy. And these are things that are happening, and no one is saying this Black woman, but you can see that the situation is happening to a Black woman. So it's not until we raise up the differences and uncomfortably say that Black women have adverse health outcomes, period. But even more so as it relates to maternal health outcomes than their white counterparts. The harm is in not saying it at all. And so when we look at maternal health outcomes in the United States, they're abysmal compared to other countries that are as developed, quote unquote. We have a birthing report card rate of a C. So generally speaking, health outcomes for maternity and maternal health are abysmal. They just are. For all people, Black, white, tall, short, thin, wide, brown, all people. Additionally, when you dig deeper, and you don't have to dig that deep, when you just pull back the first layer there, you then see that those numbers are bad, and for Black women, they are 3 to 5 times more likely to die from their maternal health issues than their white counterparts. These numbers have been made equal, and so the statisticians, the people that do the number crunching, I am not one of those people. The statisticians have taken into account socioeconomic status, education, how much money you make, all that kind of stuff. The numbers don't change the more money a Black woman has, or the more resources that she has, or the more education that she has. You can be the smartest, most well-paid, highest resourced Black woman, and you're still 3 to 5 times more likely to die than your white counterpart. And so when we look at mental health outcomes, there's so much to unpack here. Mental health conditions are the leading cause of maternal mortality. 1 in 5 women. 1 in 5. So if you count 5 women that have given birth or have reproductive organs, mental health conditions are the leading cause of maternal mortality, affecting 1 in 5 women. Depression is the most common perinatal complication. And so when you hear those numbers and then read that Black mothers and birthing people, while they have the highest rates of depressive symptoms, they're significantly less likely to seek treatment and to receive follow-up treatment for maternal mental health conditions. A story is developing here. When we consider the prevalence, so how often this is happening. And we break it down a little further when we look at depression being the highest of the mental health conditions or issues that a birthing person has in their pregnancy, postpartum, delivery, that 1 year postpartum time frame. There are characteristics that you see for those that experience the highest amount of depression and mental health conditions. And those folks are people that have participated in WIC, Women, Infant, and Children Nutrition Programming, people that have utilized Medicaid for delivery, people that have completed 12 years or less of education, people that have experienced intimate partner violence before and during pregnancy, and young people that are giving birth 24 years and younger. I personally was all of those people outside of the 12 years of education. I was on WIC, Medicaid, had experienced partner violence, and I was under 24 for the birth of all of my children. I think I was actually 24 for the birth of my last kid. And so when you see me, you don't see those things, right? Kelly has made it. She's got a great job working for the government. She's got this, she's redeveloped and redesigned her life. And she's, Be the Light, Healthy, Illness podcast and Front Seat Life and mental health workshops and keynote addresses. And oh my gosh, all the plants. And when I see her, she's smiling and she's always encouraging other people. And all those things are true. And also when I look back to my birthing era, because that era has long since passed. When I look back to my birthing era, those things are relevant to me. My depression was diagnosed as postpartum depression, and I had it before and didn't know that was what I was dealing with in life. And as you know, I'm still living with that. That's okay. We're using all the tools and doing all the things. But looking at me, you don't see that as my past. How thankful I am that I lived through my maternal health experiences, but there are many of us that are not. And so what can we do? How do we create a society where we actually care for all people, where we ensure that no matter who you are, no matter what you look like, no matter where you came from, no matter how tall you are or short you are, right? That you have the same opportunity for a good life. I don't have that answer. But what I do know is that individually, we can show up differently. Individually, we can make changes to this big thing we call the system by how we move about our day-to-day lives. And so in part, that is where Be the Light comes from, right? I can't force the world to be better. I can't force people to be better, but I can be better. I can challenge others when there is conversation or words used that are disparaging to all people, just not Black folks. I'm just not talking about Black folks, but all people. I can challenge conversations. I can raise children that are empathetic, that are wise and educated and know how to treat others better and well. I can show up differently in my day-to-day life, in my work. I can, yes, be the light, right? But also I can do the work to uncover where I have privilege and uncover where I can make a difference. And so it's different for everybody because we all do different things in life. I don't want you to get caught up in this belief that you have to be a part of, you have to be this decision maker. You've got to be the person with power, quote unquote, with power. But that you can, in the place that you are, in the work that you do, in how you show up, in how you interact, you can make a change for the better. And so do you work in human resources? Like, I don't know if that's where you are, then you can begin to look at your human resources policies. Maybe you're not the person that makes the changes, but when the conversation comes, you can be educated to advocate for Black moms. If you work in clinical spaces, you can advocate specifically for Black moms. Why? Why is it necessary to say Black moms, Black birthing people, Black folks? Because we are the ones that are dying the most. And so there are ways you can show up if you work in education or are involved in civic groups that work with young people, children, and young adults. You can share knowledge. You can teach them, right, about advocacy and asking for help. You can do the work personally, not, again, just to show up better. Yes, we want to do that. We want to show up better. We want to be the light. But in being the light, encouraging those in your circle to also do the work, to, again, educate youth and young people. All of these young people now, they know, right? They know. But the systemic side of things, how to advocate, the importance of going to the doctor, the importance of speaking up, right? You can do that part. You can begin to break down cultural stigma around asking for help. We do that in our day-to-day lives with the people that we love and care about, letting those that we know and don't know and understand that it's okay to ask for help, that you are a safe, brave place for people to come to. And your job is just to listen, right? To be there and to point them in the right direction. You're not a therapist unless you're a therapist, right? But you're not in that particular space to be a therapist. You're in that space to be a person that's there to listen and to point them in the direction of help. That's why I always bring up 988, the suicide prevention talk line. Yes, for suicide prevention, but also for mental health emergencies, for um, urgent conversations, for someone in a crisis. You can dial 988. You can ask the tough question: are you are you thinking of killing yourself? By asking that question, you are separating harm from death. I've shared before that personally, being asked, do you want to harm yourself when I was suicidal? No, I don't want to harm myself. I want to kill myself. Those are different things. And so being brave and asking, do you want to take your life, can save a life. So doing the self work so that you're comfortable in a very difficult and uncomfortable time and space to ask that tough question so that that mama can get the help and care that she needs. Helping break down this superwoman schema. I've presented on this with the links here in Buffalo. Breaking down this notion that Black women have to be all things, that we have to show up as the superhero, that we can do it all. We have to do it all. We must show up in all the places, in all the ways, and do all of the things. Saying no to that. That often comes by you taking off the cape. So you showing up with boundaries helps someone else who you may not even know needs it show up with boundaries. These are all things that we can do to help change Black maternal health outcomes without being a health provider. Everyone's not a nurse or a midwife or a OBGYN. I am not a clinical provider. I am a doula, but I do not provide clinical services. And so we can show up differently. We can change the conversation and we can change maternal health outcomes for all, yes, and specifically for Black mamas and birthing people. And so I want to give a big shout out because the information that I shared with you today comes from the Black Mama Matter Alliance, Black Mamas Matter Alliance. And I think it's important, first of all, to not claim information that, you didn't come up with. So the data that I shared and some of the takeaways I shared came from their push around Black maternal health and Black maternal mental health. And so they have a fact sheet on their website that you can grab if you're interested in learning more. But being in a position to make change, being ready and aware and knowledgeable so that when in need, and you often don't know when the need arises, you're just in it, you are prepared, that you've done the personal work to be able to help birthing people manage through a very difficult, trying time It is not always joyful. It's not always pleasant. It is not always filled with all the good feels. And people need to know that they can turn to someone and ask for help. Are you that person? I hope that you are. And together we can begin to make change. I owe you a meditation, and that is coming right away. Our next episode will be the fourth in the series, but I wanted to just talk about Black maternal health on the heels of Black Maternal Health Week so that we can continue the conversation. People find that there are so many other things to talk about that they think are important. I live in a town that is a city, but Buffalo is a town, man. Bills fever, Sabres fever. Sabres are in the playoffs for the first time in like 15 years, which is great, right? I get that. It's incredible. Yeah. Go Sabres. I want the best for them. But I really want the best for Black mamas giving birth out here in these streets. And so a big shout out to Shannon Johns at Calming Nature Doula Services and Center. She posted just to kind of keep it real post around the importance of Black maternal health outcomes and Black maternal health and Black women and Black birthing people. And that conversation is a big part of why you and I are having this conversation today. So go like and follow Calming Nature Doula Services. That's where I do my doula work through. So full disclosure there. If you bring me on as your doula, it will be through Calming Nature. So Calming Nature Doula Services are the folks that I rock out with. Until the next time, 988, right? 988 call, text. They're there 24 hours a day, 7 days a week. Also 211 for general human resources. If you're looking for, who to call, if you're looking for respite services or going through some things and you don't know where to start, they have databases across the U.S. of places to go, people to talk to in your community. And so you can dial 211, go to 211 in your browser and do a database search, call them and they'll do it for you and give you a list of all the places you can go. And your doctor. I have not, I believe, really said this before about the benefits of primary care doc and OBGYN doc. If you have those body parts, it is important to get preventative care. And so I encourage you, if you're not doing that, to begin to do that regardless of your age. Build a relationship now before sickness occurs. And, get those baseline numbers done so that you know where you stand, so that you can work together with your healthcare provider to build a program for health for you that makes sense for you. And so maybe we'll talk about primary care and OBGYN care later on. Always thinking about what to cover, but they're so important to your mental health as well. So until the next time, I encourage you to be the light and like, subscribe, and share this episode and all the episodes, not just of the Healthy Illness Podcast, but all of the episodes and podcasts on the Jazzcast Pros Network. Bam. I'll see you soon.